It is said Vusamazalu Credo Mudwa could resurrect the dead. Let us explore the remedies and plants he was using.
Male reproductive health is often discussed only in terms of sexual performance or fertility. However, from both traditional and modern medical perspectives, the male reproductive system is deeply influenced by overall health, lifestyle, and long-term physiological balance. Many conditions that affect sexual function, fertility, and vitality are not isolated disorders of the reproductive organs themselves, but manifestations of systemic disease processes. Traditional African medicine and other holistic systems have long emphasized that reproductive health reflects the state of the entire body. In these systems, disease does not begin suddenly. It develops gradually, often silently, as a result of chronic inflammation, metabolic imbalance, infection, environmental exposure, and unresolved stress. Understanding the diseases that affect the male reproductive system is essential not only for treatment, but for prevention. One of the most significant contributors to male reproductive disease is chronic inflammation. Unlike acute inflammation, which is a normal healing response, chronic low-grade inflammation persists over time and damages tissues slowly. Blood vessels, nerves, glands, and hormonal pathways are particularly vulnerable. In the reproductive system, chronic inflammation impairs blood flow, disrupts nerve signaling, and alters hormonal communication. Over time, this can lead to erectile dysfunction, reduced libido, decreased sperm quality, and increased vulnerability to prostate disorders. Inflammation is often driven by diet, stress, metabolic dysfunction, and environmental toxins. Highly processed foods, excess sugar, unhealthy fats, and chronic psychological stress all contribute to inflammatory pathways. Traditional medicine emphasizes anti-inflammatory diets, rest, and plant-based support to reduce this burden. Infectious diseases also play a major role in male reproductive health. Urinary tract infections, sexually transmitted infections, and chronic prostatitis can cause lasting damage if left untreated or inadequately managed. In traditional medical systems, infections are not viewed only as external invasions, but as signs of weakened immune resilience. Plantago species, discussed earlier in this series, have a long history of use in conditions involving urinary irritation, infection, and inflammation. Their demulcent and astringent properties are traditionally used to soothe mucous membranes, reduce irritation, and support healing of the urinary tract. Recurrent infections of the urinary and reproductive tract can lead to scarring, chronic pain, fertility challenges, and sexual dysfunction. Early recognition and supportive care are essential. Metabolic disorders represent another major category of disease affecting the male reproductive system. Diabetes, insulin resistance, obesity, and metabolic syndrome significantly increase the risk of erectile dysfunction, reduced testosterone levels, and fertility problems. From a physiological perspective, high blood sugar damages blood vessels and nerves. The delicate vascular system that supports erection is particularly vulnerable. Metabolic disease also alters hormonal balance, increasing estrogen levels and reducing testosterone production. Traditional medicine emphasizes the importance of stable blood sugar, digestive health, and liver function in maintaining reproductive health. Dietary patterns that support metabolic balance are considered foundational rather than optional. Hormonal disorders further complicate male reproductive health. Testosterone deficiency, estrogen dominance, thyroid dysfunction, and adrenal exhaustion all influence sexual function and fertility. These imbalances rarely occur in isolation. They often reflect long-term stress, poor sleep, nutritional deficiencies, or chronic illness. Traditional tonics such as Mondia whitei, Iriacema species, and ashwagandha are often used not as hormone replacements, but as regulators. Their role is to support the body's ability to restore balance rather than override natural processes. Environmental and occupational exposures also contribute significantly to male reproductive disease. Pesticides, heavy metals, plastics, and industrial chemicals act as endocrine disruptors. These substances interfere with hormone signaling, sperm production, and reproductive tissue integrity. Traditional medicine places strong emphasis on detoxification through liver support, hydration, and plant-based nutrition. The liver plays a central role in hormone metabolism and toxin elimination. When liver function is compromised, reproductive health often suffers. Psychological and emotional health must also be considered. Chronic stress alters immune function, increases inflammation, disrupts hormonal signaling, and impairs sleep. Over time, this weakens the body's ability to maintain reproductive health. Traditional systems do not separate mental and physical disease. Emotional stress is understood to manifest physically, including in the reproductive organs. Anxiety, unresolved trauma, and chronic tension are often addressed as part of reproductive health restoration. Autoimmune and inflammatory conditions also affect the male reproductive system. Conditions such as autoimmune orchitis, chronic inflammatory prostatitis, and systemic autoimmune diseases can impair fertility and sexual function. These conditions require careful medical evaluation and integrative management. Another important but often overlooked factor is aging. As men age, cumulative exposure to inflammation, metabolic stress, hormonal changes, and environmental toxins increasingly affects reproductive tissues. The prostate gland, in particular, becomes more vulnerable. Prostate health occupies a central place in male reproductive disease. Conditions such as prostatitis, benign prostatic hyperplasia, and prostate cancer develop over time and are influenced by inflammation, hormonal balance, and lifestyle factors. Traditional medicine emphasizes early awareness and prevention. Subtle changes in urinary flow, pelvic discomfort, nocturnal urination, or changes in sexual function are considered signals rather than inconveniences. Importantly, traditional systems stress that disease prevention begins long before symptoms appear. Supporting circulation, reducing inflammation, maintaining metabolic balance, and managing stress are all considered protective measures. Modern medicine provides essential diagnostic tools and treatments, particularly for serious conditions. Traditional and integrative approaches complement this by focusing on long-term resilience and prevention. It is critical to emphasize that not all reproductive symptoms indicate serious disease. However, persistent changes should never be ignored. Early evaluation allows for timely intervention and better outcomes. Education empowers men to participate actively in their health. Understanding the interconnected nature of reproductive disease reduces stigma and encourages proactive care. When male reproductive diseases develop, traditional African medicine does not treat the symptoms in isolation. Instead, plants are selected based on the dominant pathological pattern involved: inflammation, infection, hormonal imbalance, circulatory weakness, nervous system exhaustion, or prostate congestion. Several African medicinal plants are consistently used across regions to address these patterns. Bulbine natalensis is widely used for erectile dysfunction, reduced libido, and prostate-related weakness. Traditionally, it is considered a strengthening plant for male vitality and circulation, often used when reproductive disease is linked to aging or hormonal decline. Hypoxis hemerocalidea, commonly known as African potato, plays a central role in prostate health. It is traditionally used for prostate inflammation, urinary difficulties, and immune modulation. In contemporary integrative practice, it is often combined with saw palmetto or plantigo species to support urinary flow and prostate tissue health. Warburgia salitaris is one of the most potent antimicrobial plants used in African traditional medicine. It is employed in cases where reproductive disease is linked to infection, including chronic urinary or sexually transmitted infections. Due to its strength, It is traditionally used in small amounts and often combined with soothing or nourishing plants. Xanthoxylum capense is traditionally used to stimulate circulation and nerve function. Poor blood flow is a major contributor to erectile dysfunction and tissue degeneration. This plant is often included when reproductive disease presents with coldness, weakness, or lack of responsiveness. Sutherlandia frutescens remains essential when reproductive disease is associated with chronic illness, immune suppression, or prolonged stress. Rather than stimulating sexual function directly, it restores resilience and metabolic balance, allowing reproductive health to recover gradually. Saw Palmetto serenoa repens, though not indigenous to Africa, has become widely incorporated into African integrative herbal practice, particularly for prostate enlargement and urinary symptoms. It is valued for its role in moderating excessive dihydrotestosterone activity and reducing prostate inflammation. Traditional practitioners emphasize that reproductive disease rarely requires a single herb. Instead, carefully selected combinations address multiple layers of dysfunction simultaneously. This integrated botanical approach sets the foundation for understanding prostate cancer and prostate enlargement, which we will explore in the next 2 episodes. In the next episode, we will focus specifically on prostate cancer. We will explore risk factors, early warning signs, prevention strategies, and supportive approaches from both modern and traditional perspectives. Following that, episode 11 will address prostate enlargement, urinary symptoms, and long-term prostate support, completing this section of the series on male reproductive health. Stay with us. The plants are still speaking.
If this video resonated with you and you feel curious to explore natural healing more deeply, you're invited to connect with Health Habits Holistic Care. You can visit the website to learn more or book an online consultation at your own pace.
This knowledge is shared in the spirit of remembrance. Plants carry wisdom passed through generations, and each body receives that wisdom differently. This information is shared for educational purposes only and does not replace personal medical care.